Good morning. So we are live from Bellflower Physiotherapy. I have my colleague Ruth with me this morning, and we are really excited to talk about a program that we'll be offering starting next month. So it's specifically for people who have issues with either hip or knee pain, not knee or hip pain, and it is having an impact on their life. They want to be active, but they can't because of the pain. So this program has been designed for that. So it's people specifically more with osteoarthritis. So the sort of wear and tear, wear, repair.
We'll touch on that, yeah.
So first, let's talk a little bit about osteoarthritis, just to give people an idea if they possibly have something like that. So if you want to maybe talk a little bit just briefly about it.
Yeah, for sure. So osteoarthritis is, first of all, very, very common. So as we age, the majority of people actually inevitably will end up with either hip or knee arthritis. A lot of people have it in their hands and their feet. And in some ways it is degeneration. So a lot of people say, oh, it's wear and tear, everyone's going to have it eventually. There's nothing you can do about it. That's not true. So the truth of it is, it's a cycle of wear and repair, where the repair is not keeping up with the wear. So there is a lot that we can do to stimulate the repair side of things. And there has actually been research to show that if you have some cartilage remaining in your knee, it can regenerate given the proper tools to do so. So it's not a life sentence of it's all downhill from here. There's a lot we can do to help improve your symptoms, help manage them. A lot of people will, in the long run, eventually end up getting a joint replacement, but that's usually a long way down the road, and you want to make sure you've tried everything else first. Another really important thing to know about osteoarthritis is traditionally it was thought that it was really just within the joint. It's affecting your bones, it's affecting your cartilage, but what they found is it actually affects the entire joint and all of the structures around it. So we're also looking at ligaments, tendons, muscles, connective tissue. These are all impacted by osteoarthritis, and there are a lot of things that we can do to help strengthen those tissues, to diminish the symptoms, help get you back to the activities that you want to be doing.
So there's this cool program that was developed in Denmark, and it's called GLAD, which stands for Good Living with Osteoarthritis in Denmark. So this program, it's been brought to Canada and has been shown to be very successful in minimizing symptoms, improving quality of life, decreasing time off of work, so making things a lot more functional and easy for people to live with osteoarthritis. So I'll have you talk a little bit more about what GLAD is.
Yes, we're really excited about this program. It's fantastic. I did the training, it would have been at least a year and a half ago, and I've been able to run the program previously with great success. So it's a combination of education and exercise that's specifically geared towards people with hip and knee arthritis. So we have 2 hour-and-a-half education sessions where we talk all about the physiology of arthritis, what you can do about it, what the latest research is saying, how to understand your symptoms, what your body's trying to tell you, etc., etc. So you learn a lot within those sessions. It's also a great opportunity to ask questions, to learn from the other participants in the program, because you're not alone. If you have hip and knee arthritis, a lot of people are out there experiencing the same thing, and you can learn from each other. So that's one of the huge benefits of having this offered in a group setting, is that you then form a community of people that can help support you through this process as well. So in addition to those education sessions, we have 6 weeks of exercise training, and these are hour-long sessions twice a week, supervised by a physiotherapist. Yes, by me specifically. And then hopefully in the winter we'll be having another physio on board. But it is physiotherapy. It's not fitness training. It's physiotherapy geared specifically towards people with hip and knee arthritis. So it's a really, really exciting program. Lots of fun, lots of energy, lots of good learning opportunities, and some really good life changes that come from it.
So not only are you actually working on things that can help improve strength and stability and take pressure off the joints, But at the same time, too, you're learning self-management techniques. So that's where I think the education component is super important, because it helps you to be able to, what if you have a little bit of a flare-up or whatnot? Like you know, okay, well, maybe it's because of this, and so if I can do maybe this just simple movement, then things relax a little bit. So it's really equipping you that you don't need to come in necessarily for consistent physiotherapy. Once you get through the program, you'll be able to really be able to manage your own symptoms. You're in control of this thing. But if worst case, if something comes about, then always coming back to consult, maybe just being refreshed on certain things is always sort of helpful too.
Yeah.
So the nice thing too is, as Ruth mentioned, it is a group setting. So you're learning from others. You're not alone in the process. But because it's a group setting, the cost ends up being lower as well too. So it's making it affordable that people can get really the sort of the care and the attention that they need, but without having to spend a lot of money in the process too. So it's a nice thing about sort of the group setting.
Yeah.
And as Ruth mentioned too, because it is physiotherapy specific, it's not necessarily a fitness class, most insurance companies recognize the GLAD program. So it is, you can submit it to insurance and get part of that reimbursed back if you do have insurance. So again, adding that other level of affordability, and so in the process you are helping yourself out too. I think we talked about what the program is. So it's 8 weeks total, right? So 2 education sessions, which are an hour and a half, and then the 6 weeks, twice a week of exercises. So all in all, the program is a 2-month process. There is initial assessment, sort of a baseline assessment to track. That's the other thing, because this program is essentially, it's a research program. So there's metrics, there's numbers that are measured to ensure that I think certain goals are being met, or people are progressing or improving. I don't know if you want to elaborate a little bit more on that.
So because they've had a grant to help put this program in place across Ontario, they're wanting to do quality assurance to make sure that this program is delivering on the promises it's making, and to make sure that there's consistency, that a GLAD program offered here is the same as a GLAD program offered in Toronto, is the same as Thunder Bay. So with that, we do collect some outcome measures, and you have the option to opt out if you want to, but it's a great thing to opt into because you can help to see your own progress, not only right before and then right after the program, but a year down the road. They ask you all these questions again to see if you've been able to keep up what you've learned and what you've gained from the program. And that, I think, is really key to emphasize, that this program is 7 to 8 weeks with me, but then it's a lifelong change. So you're sent home with all the exercises, all the information that you gain from GLAD. You go home with that, and the expectation is you'll continue that on your own throughout, because osteoarthritis is a lifelong diagnosis. You don't get rid of it. We can do a lot to help manage the symptoms and make it so that you live doing everything you want to do, but it is a lifelong disease, so you do have to continue to manage and use what you've learned.
I think it's cool though that we can take a measurement at the assessment and see this is where you're at, and then you go through the program, and then this is where you're at now. Because sometimes we go through something, especially a 2-month program, you kind of forget where you were at initially. So when we do a 10-meter walk test, and you're able to do it much quicker or in less pain, and then I guess I am better, right? So I think it's good to also notice the improvement. So I think it's nice that we do take measurements sort of before, after, and then sort of that longer term effect after the fact.
Definitely.
Anything else to add? I think we covered a lot.
I think that's a good kind of comprehensive overview of what the program is. Of course, if you have questions, please don't hesitate. Leave your comments or leave your questions in the comments. You can always email us. I'm happy to take phone calls as well. Every once in a while, you can reach me on a break.
So the thing too, our clinic is very small. So we're obviously not able to offer it in our setting. The assessment will be done here with Ruth, but the program will be offered in conjunction with Downsize Fitness. So they're just off of Taylor Creek. So they're in Taylor Creek Business Park. They have a big space. and they've graciously allowed us to use it for this program. So we have enough space to do everything that we need to do. And we're aiming for sort of a mid-October launch. We already have 2 people in the program. So sort of getting the word out there. I think that's it.
Yeah. Do we have any questions from viewers? So far, so good?
Not yet.
Excellent.
Okay. So as Ruth mentioned, any questions about the program, I think it's better to have the discussion with you directly. So anybody has any questions about the program, call into our office. On our website, we do have a web page about GLAD. There's a comments section there that goes to the admins, so they can have Ruth contact you, because I think it's good if you know best about the program. And so some people might have specific questions in terms of like, oh, what if I can't do this or I can't do that? So I'm sure Ruth can figure out a way to make it sort of accommodate so that you can do something similar that isn't as irritating for the joints and stuff.
Yeah.
So leave us your comments. We'll do our best to answer the questions. And thanks for watching. And if you know anybody who is having symptoms of hip, knee osteoarthritis, or just complaining about pain, they're limiting, they limit what they do because of the pain, they would be ideal candidates for this program, because that's what we're trying to target. And even there's a lot of organizations now that are looking into providing some sort of subsidy so that these programs can be run, because in the long run, I think we save healthcare dollars.
Absolutely.
Because joint replacement surgery costs so much to the healthcare system, versus going through this 8-week program has a minimal cost. So not only are we helping you manage better, but I think we're freeing up orthopedic surgery departments and stuff too. So I think all in all, this program has a lot of value to add. And in Denmark, they've had some phenomenal results. And that's, like I said, that's why they brought it into Canada. So leave us your questions and comments. Thanks for watching. And pass on this information to anybody that you know that could benefit from this program. Thank you.
Definitely.